Correctional officers go through a lot of training before they're ready to watch over inmates, and part of that includes what protocols to follow when an inmate is suicidal. But a wrongful death lawsuit claims in Aiken County's detention center those protocols are not being followed. Hallie Turner is in our newsroom. So Hallie, walk us through what correctional officers should be doing.
Well, we found that a resource guide for Southern Health Partners details what correctional officers are supposed to be doing when medical emergencies happen or when someone is suicidal. But Adams Crow's family says many of these protocols were ignored, and now their son is dead. Lila Crow's son, Adam, struggled with mental illness.
With bipolar, your brain does not shut down. It's in a constant whirl. He tried to supplement that with alcohol,
which landed him here in the Aiken County Detention Center in May of 2017, facing DUI charges. According to the lawsuit, Adam told medical professionals he had a problem with depression, drinking, and a history of suicide attempts, but he was still cleared to go to jail. Cameras show Adam arriving at the detention center around 4:44 that afternoon. Less than 4 hours later, he took his own life. Something Lila says could have been prevented had officers followed the intake protocols written in the Southern Health Partners Officer Training Manual.
They don't have time or patience at the hospitals to deal with these people. Take them to the jail. Jail people can handle them. No, they can't. My son died under their watch.
This manual covers intake, medical screening, suicide prevention, and more. Once an inmate is accepted into the jail is responsible for adequate medical care. It also states suicide is the most common cause of death in a correctional setting. Not only are these places charged with protecting the public from inmates, but they're supposed to protect the inmate from themselves. Lila says that didn't happen.
They were responsible for keeping my son safe. They just completely flopped on that matter.
It says typical suicide victims are men in their 20s to mid-30s who struggle with mental disorders, abuse issues, and more. All things the lawsuit states Adam had. It states screening a patient during intake is the first step to notice suicide risk. And if the patient says yes to one or more of the questions, they are considered to be at an increased risk of suicide. Inmates with high risk are supposed to have check-ins every 10 to 15 minutes. But footage shows Adam went hours without anyone ever checking on him.
Our son's dead. We can't bring him back. I want justice, and I want people to do better.
In Aiken, Hallie Turner on your side.